What's up, A to Z Sports DocTalk, first one of the year. How about that? After week one, wanted to spend some time learning and trying to figure out some of the mystery surrounding the MCL injury for Titans wide receiver DeAndre Hopkins, as he did play in week one at Chicago, seemed to be limited in a snap count type situation. Didn't run a ton of routes, caught one pass for 8 or 9 yards to continue his games of 167 games consecutive of having at least one reception. So he got that much done. But here to help us out and maybe educate us a little bit about the MCL as a whole is Colin Looney, MD of the Bone and Joint Institute, boneandjointtn.org. I talk about them all the time. If you have an injury in life, that's where you should go to in Franklin, the region's destination for comprehensive orthopedic and sports medicine care. That's where you should go. I was there for my patella tendonitis, had some physical therapy sessions after I saw Dr. Scott Arthur back in the spring. But Dr. Colin Looney, hip, knee replacement and preservation. You do a lot of other things, shoulders and elbows, hips too. So welcome in. Thanks for jumping on again. I know we've talked to you in the past about some other injuries, but really curious to hear about your thoughts on this MCL situation with Dehop. So thanks for the time today.
Oh, thanks. Thanks for having me back. Glad to be on the show again.
So I want to set the table for this because the graphics we have right here is from July 31st. That's the last training camp practice we saw DeAndre Hopkins. He had that left knee wrapped, and then we didn't see him again for a while, and it came out that he was going to miss 4 to 6 weeks with some type of knee strain. Then leading up to week one at the Bears, DeAndre Hopkins gave Paul Kuharsky an update, a quote from Dehop himself. I had the MCL tear maybe 4.5, 5 weeks ago. So the thing about those is it takes a whole year for them to heal, he said. Obviously, it's pain at this point. Hopkins did say that he was going to let Paul suggest potential surgery down the line. He wasn't going to speak like that. But Dehop did play in the game against the Bears. Again, 1 catch on the day, limited snaps. So I guess to kind of get this started, MCL tear was kind of a surprise that I heard DeAndre Hopkins say himself. So can you kind of take us through on the elementary level on an MCL tear and then what the different levels of those MCL tears might be?
Yeah, sure. I guess as much as coaches like to sit around and look at film and draw and put plays on the board, orthopedic surgeons, we like to make classifications for things. And, we classify every injury, and really a lot of them aren't really worth a dang. But the one for MCLs is pretty valuable in talking to athletes and talking to patients about when they're going to play again, because there's only three types of injury for the MCL. There's 1, 2, and 3. One is one, and they're all considered MCL sprains, but 3 is a complete tear of the MCL. And so when somebody comes off, you see someone fall down on the field and the doc helps them off. I always tell people, really, the best news you can get for that person who can't get off the field because of their knee injury is to be told they have an MCL injury. An MCL injury is definitely more favorable than most ligament injuries of the knee. And that's because most MCLs heal on their own. It's a big, broad, flat ligament. It's got a lot of blood supply, and it tends to heal on its own. And even a 3 typically can heal on its own, and that's a complete tear. A grade 1 is a small partial tear where there's no instability. There's not any sloppiness to the knee at all. A grade 2 has some mild opening, and the grade 3 is like you've seen it, where they stress the knee from the side and it really opens up like a hinge, and that's a grade 3. That athlete has torn his MCL completely. But the MCL is it's not a rope like the ACL. Rope tears, it's done. But this is a big, flat ligament, and even a complete tear can heal and a lot of athletes. And there's some exceptions, and we'll talk about that.
So because an MCL can heal itself, does that require rest? If a player is going throughout an NFL season, all the rigors therein, will that heal if you're playing on a week-to-week basis, or do you have to take some time off?
for certain, and it, an average, a grade 1, why it's a good to grade them is that's about a 5 to 7 day injury. Like I'll hold an athlete out about a week with a grade 1.
Oh, wow.
A football player. And then a grade 2 is it's about a 2 to 4 week injury in season. Right. And then a grade 3, that's about a 6 to 8 week in season injury. So, it gives you some perspective on when that athlete's going to return when they say what type of grade it is.
And obviously we don't know the grade on this. DeAndre Hopkins.
I'm not treating him, so I don't know either.
For sure. And that's the funny thing with this is the fact that DeAndre Hopkins kind of offered this up. Like, yeah, I tore my MCL like 4.5, 5 weeks ago. And everybody's like, what? Where did that come from? Which I think is such an interesting deal. So he did go to LA and train and rehab for a couple weeks there. Is there anything an athlete can do? Like, I'm guessing he's a super specialist out in Los Angeles that he was going to go see. Is there something you can do to accelerate some of that healing process?
Yeah. There's the basics, and then there's some things that we'll do on top of that. One is as soon as an athlete hurts their MCL on the field that night, whether it's Friday or Saturday or Sunday, depending on what level they're playing off, we take them off the field. They're not playing that night, but then we start immediate rehab on it. So quad sets, getting your quad stronger, straight leg raises, getting your abductors, the muscles around your hip and your core strong, and that helps protect it. And we also want to get the motion and swelling back, because if you don't get that down, you put the athlete back on the field, they're going to get hurt again, and they may hurt something worse than their MCL. They may tear their ACL or other ligaments, and so we got to get their motion back and the swelling down. And so therapy is critical. And so we'll always have good work with a good sports therapist. There are some other tricks of the trade. Different types of bracing helps, and you'll often see patients or athletes on the field with different types of braces, a hinged knee brace, a bigger sort of more supportive brace after they tear their ACL. You can see he's got a really nice taping protocol going in the pictures where they've taped him up, and then you can see that where he's got that, and so that really helps. Skilled players on skilled positions, they don't like to wear big, RoboCop hinge braces, right? So we got to get a little bit more elegant in how we tape them and brace them. Whereas you'll see most linemen are already in MCL braces, and they don't even have an MCL, right? They're trying to protect their MCL.
Mm-hmm. So it sounds reasonable to guess, because he was out for over a month, is, in his own words, still kind of coming back and healing these first couple weeks of the season. Seems reasonable to think he had a grade 3 sprain. Does that sound right to you?
Yeah, it could be a grade 2 or a grade 3. I doubt it's a grade 1. Mm-hmm. And, sometimes what happens is you put a grade 1 in too early and they turn it to a grade 3, right? And so, that's a possibility too.
Well, so that's my next question. As you're coming back from this injury, what is the re-injury or maybe further damage potential when you're playing a skill position in the NFL? And maybe which activities or types of movements are the most dangerous?
Yeah. Well, one is you put an athlete in who doesn't feel confident on their knee. They don't have good motion. That's a setup for an injury. And then, the way it happens, if you'll let me show my knee on the camera.
Bring it on. Let's see what we got.
All right, here we go. So let me get my knee up there. All right. I don't know if this is going to work. It's a blow right here to the outside of the knee.
Right.
Okay.
And so it's a straight lateral blow. Sorry, that didn't work too well, but we'll try it again next time.
We got the picture.
But, when someone takes a blow to the outside of their knee, it's kind of crazy to think, well, it's the injuries on the inside, but think of it as like a hinge, right? And so the force goes on the ligament on the inside of the knee trying to protect it. And they'll get a bone bruise on the outside of their knee often, but it's the ligament on the inside of their knee that gives out, which is the MCL.
So go ahead, Austin.
No, I was going to go into, because last year, remember, we talked a lot in August about Traylon Burks for the Titans having an LCL injury, which is the opposite, hit inside or that stress inside deflects the outside. And we talked some about the limitations of routes that an LCL injury takes. What is it? What type of those movements, what type of cuts would a player be struggling with an MCL?
Yeah, so you're gonna, if you notice, his route and he ran was pretty straightforward.
Yeah.
And you're gonna keep a guy who's not 100% on an MCL. You're gonna keep him on straight inline routes, and it's the cutting and side to side stuff that's going to put stress on it, so starting out, it's just straight inline running where we're rehabbing a guy fresh out after an MCL, and same on the field.
Yeah, for sure. And for his own words, he says he feels good, feels confident in it. And DeAndre Hopkins had an MCL injury to his other knee a few seasons ago, back when he was in Arizona. And so I guess when you work with athletes that have done something like this before, does that give you a little, do you believe the athlete a little bit more? Because every kicker is going to be like, yeah, I can make the 60-yard field goal. Of course they're going to say that. That's the confidence they have in themselves. But when they've had the injury before, does it make you feel like you can trust their word more?
Yeah, well, it kind of helps you give it a timeline how they're gonna recover from that injury, and it puts some confidence in the athlete, because they know what they're up against for certain. Yeah, but like I say, I always think an MCL is kind of a blessing in disguise, really, because it's the season ending injuries that are hard when you're sitting down talking to an athlete, and at least we're talking weeks and not a season when we're talking MCLs generally.
And so for this, let's say it's a grade 3 that's healing and it's had 5 to 6 weeks now. What is the re-injure? Is it just starting that grade 3 clock over? Is that kind of the worst case scenario for the MCL in particular?
Yeah, if he took another lateral blow and he opens it up again, that restarts the clock, right? And that's why you want to make sure they're good and ready, and the knee feels stable on exam when you put them out there. That you still don't have this loose hinge that's not stable, and they don't, that puts your athlete up for risk of injury. And honestly, I've seen athletes go out too early after an MCL, and then that's when they really incur a bad injury.
Dr. Looney, you mentioned at the top of the interview certain exceptions. Yeah. Would it take a re-injury to cause a doctor to say maybe this requires surgery, or is it a certain type of tear that doesn't heal where you say, okay, we've given this a month, we've given it 6 weeks, it's not getting better? Is that when you have to start talking surgery?
Yeah, there's two major reasons we'll fix an MCL. Sorry, one is if it almost always happens at the top or the mid substance of the ligament, but when it happens down lower on the shin bone, the tibia, that's a different kind of animal altogether, and that we get more worried about those, because what happens is, when it happens on the tibia, it kind of wraps, it tears and then wraps and flips over on itself. And that doesn't heal and doesn't heal that well. And my mentor, Dr. Stedman, who taught me, much sports medicine, he says those were he fixed those on all the NFL guys. And that's where I learned from him is those are the ones we fix, and they're called stenters. And what it means is that it tears right at the tibia, which is the lower part of the ligament. It flips on itself, and it's not going to heal. So that guy, if you don't fix him, is going to have a trick knee that's not stable. And so those are ones we would fix. And it's a very rare injury in the MCL world, but they are ones that we fix.
Can you identify that immediately when you suffer the injury? You're able to tell. Okay,
yeah. So one of the warning signs is because the MCL is not stupid. It tells you where it hurts.
Okay.
And if it hurts right down at the tibia, we're worried, right?
Yeah.
And so that guy's getting a scan that night, or scan very soon, to figure out what part of the ligament's been injured. The second time we fix it is kind of what you're alluding to, is if we have a guy who is a grade 3 and it just never heals completely, and he feels unstable on the football field. And that's when, and so that's now become a chronic unstable knee. And so for him to perform better, we're gonna reconstruct his MCL. So those are the two exceptions where we'll do that.
Well, DeAndre Hopkins trying to avoid that second one. Seems like it's not the spinner. So that's, look, good news for Titans fans as far as I'm concerned, that the MCL, a blessing in disguise, that's if you're going to hurt your knee, then that's not a bad one to do it. But Dr. Looney, always great to talk with you, and the Doc Talk segments with the Bone and Joint Institute are some of the best content I think that we do out there. So definitely appreciate your time. For everybody out there watching, if you get hurt, maybe you have a knee injury or a hip or anything else, Dr. Looney's your guy right there in Franklin. Appreciate the time as always, and we'll talk again soon.
Appreciate you guys. And all the athletes, let's stay safe, no injuries.
There you go. Stay healthy.